you'll remember that we have two coxal bones, and each of those coxal bones is composed of three other bones. So you need to know the ilium, the ischium, and the pubic bone. There's also some bone markings that are really important to identify on our coxal bone. As I mentioned before, this is actually looking at it from the side. So this is a lateral view. This is the iliac crest. So this is where you place your hands on your hips when you put your hands on your hips. We talked a little bit about the ischial spine, this thing that sticks out because that can get in the way of the pelvic outlet through which the baby moves, right? Now, one of the weird things about when I look at the structure of the pelvis, I'm confused about this because there's this opening, there's this hole. Is that where the femur fits? No. So this hole is a foramen through which all kinds of structures pass. It is not a hole in our bodies. It is filled up with stuff like blood vessels and nerves and all kinds of stuff traveling through. But this is a really important. So when we look at the structure of the coxal bone, one significant bone marking is the obturator foramen. Okay, holes. It's a foramen, right? And if we look at it, when we look at the whole pelvis, right, we have two obturator foramens, right? Stuff passes through there. That's all filled up with membranes and vessels, okay? So we could ask, well, where does our thigh articulate with the coxal bone? And this is the structure right here. Just like our shoulder, our hip joint is actually a ball and socket joint. And so we can talk about the head of the femur articulates with the acetabulum of the coxal bone. Okay, so that is the acetabulum. If you look at it, it is actually a bone marking that consists of all three of those bones. And so the ischium comes together, the ilium comes together, and the pubic bone comes together to form that particular bone marking. Okay. Another interesting thing here is that pubic bone, right? And remember that that articulates anteriorly with the other pubic bone in the pubic symphysis. Symphysis means to come together at a fibrous joint. Okay. This right here is what we call the sciatic notch. And next quarter, we're going to talk about nerves. That is the sciatic nerve. So the sciatic nerve kind of passes through this notch on its way to the leg. So to the back of the leg, it passes through. So that's the sciatic notch. We also have this tuberosity. This is the ischial tuberosity, and that is what we actually sit on. So those are, that's the rough part of our ischial bone where we sit. So again, you need to know that this is a whole coxal bone. It's made of three different bones, and then there are specific bone markings that are truly significant in anatomical structures.